Vitamin B12, also known as cobalamin, is an important water-soluble vitamin. It plays an essential role in the production of your red blood cells and DNA, as well as the proper functioning of your nervous system. People at risk of a B12 deficiency include the elderly, people on the drug metformin for diabetes, people following a strict vegan diet, those taking long-term antacid drugs for heartburn. Here are 6 signs and symptoms of a true vitamin B12 deficiency. Breathlessness and dizziness. If you become anemic due to a B12 deficiency, you may feel short of breath and a bit dizzy, especially when you exert yourself. This is because your body lacks the red blood cells it needs to get enough oxygen to your body's cells. 5. Disturbed vision. One symptom of vitamin B12 deficiency is blurred or disturbed vision. This can occur when an untreated B12 deficiency results in nervous system damage to the optic nerve that leads to your eyes. The damage can disrupt the nervous signal that travels from your eye to your brain, impairing your vision. This condition is known as optic neuropathy. 4. High temperature. A very rare but occasional symptom of B12 deficiency is a high temperature. It's not clear why this occurs, but some doctors have reported cases of fever that has normalized after treatment with low levels of vitamin B12. Three. Sensations of pins and needles. One of the more serious side effects of a long-term B12 deficiency is nerve damage. This can occur over time, as vitamin B12 is an important contributor to the metabolic pathway that produces the fatty substance myelin. Myelin surrounds your nerves as a form of protection and insulation. Without B12, myelin is produced differently, and your nervous system isn't able to function properly. 2. Weakness and fatigue. Weakness and fatigue are common symptoms of vitamin B12 deficiency. They occur because your body doesn't have enough vitamin B12 to make red blood cells, which transport oxygen throughout your body. As a result, you are unable to efficiently transport oxygen to your body's cells, making you feel tired and weak. 1. Pale or jaundiced skin. People with a B12 deficiency often look pale or have a slight yellow tinge to the skin and whites of the eyes, a condition known as jaundice. This happens when a lack of B12 causes problems with your body's red blood cell production.